Hello, I'm Dr. Valerie Walker, and welcome to another exciting episode of the Medical Moment. Today we're going to talk about a subject that actually involves 1 out of every 3 people in America, and that's hypertension. A lot of people call it hypertension, a lot of people call it high blood pressure, a lot of people just say the doctor said my blood pressure was high, but we have got to address this problem because it's common and it affects so many people in this country. So let's just dive right into it. The first thing we want to just make very clear is that there are 2 types of hypertension. One is what we call primary hypertension, where there's no identifiable cause. You just start going to the doctor, getting your pressure checked. You know how that goes. You walk in one day and the doctor says your blood pressure is high. The second kind is what we call secondary hypertension, meaning we do have an identifiable cause. Some of the causes are snoring or sleep apnea. So if you're snoring your partner out of the bedroom every night, you may want to get yourself checked for sleep apnea. Problems with your kidneys can elevate your blood pressure. Certain medications can elevate your blood pressure, especially drugs like narcotics. I had a patient one time about running from the police, about to get arrested, had cocaine, and instead of getting arrested, he swallowed the cocaine, and that shot his pressure way up. So there are other secondary causes of hypertension, but today we're going to focus on the most common, which is essential or primary hypertension, which we have no identifiable cause. So first, let's just start off telling you, what is high blood pressure? Well, high blood pressure is when the blood is pumping real hard against the arteries in your system. So normally when the blood pumps, it's just going boop. Every time the heartbeat, boop, boop against the blood pressures, boop, boop. But with hypertension, and the higher the pressure go, the more force the blood is pumping through the arteries. And with that increased force, it can actually damage your arteries. So when you go to the doctor, they give you your numbers. Ideally, you always want them to say 120/80. When was the last time you went to the doctor and they told you 120/80? Well, that's ideal blood pressure. But you know you're getting in a little trouble when it's over like 120 to 129 and the bottom number is over like 80 to 99. You're getting in a little trouble, what we call pre-hypertension. So you want to talk to your doctor about that. So you go to the doctor and they give you the 2 numbers. What do they mean? Well, the first number is called a systolic blood pressure. And what that is when the heart beats, boom, and pumps the blood throughout your system. That's the systolic pressure. Now, when it pumps the blood out, it has to fill back up. The ventricle in the heart has to fill back up. That's the diastolic pressure. When the heart is relaxing and just getting filled back up with blood, that's the diastolic pressure. Years ago, they used to say, oh, just worry about the systolic pressure. That's the one that's bad. But no. We've done research and found out both of the numbers need to be down. The systolic pressure and the diastolic pressure. And you always want to keep an eye on those pressures. A little later, we're going to talk about the ABCs of your health, and you're going to know this stuff so good and so hard, you're going to be on top of your blood pressure at all given times. So who gets high blood pressure? I mean, who does it affect? Well, first of all, and patients tell me this all the time, is that it affects African American people much more than anything. I had a lady call me one time. She said, you know what, Dr. Walker, everything you talk about when you do television now, you said it affects African American people more. Well, guess what? It does. And there's a lot of reasons for that. A lot of times they say it's our lifestyle. A lot of times they say we don't exercise enough. But for sure, it's more common in the African American community. Also, high blood pressure increases with age. As you get older, as most things do. When you're young and playing outside in the country like we did not have a care in the world. But as you get older, let me tell you something, aging is no joke. All types of things start happening, and the blood pressure has a tendency to start creeping up as we age also. Then the other thing you got to pay attention to is the family history. Don't y'all be scared to sit around and talk about the family history. We always getting together for picnics, parties, family reunions. When was the last time you got together just to have a discussion about What are the things that run in the family? These are the things that you need to know. Because like I say in my best-selling book, and my friend Terry always remind me, you cannot run away from your DNA. You got to know what runs in the family so you'll know what you have to look out for. Now, some of the identifiable risks that we cannot change is RAG. I call that RAG. We can't change our race, our age, our gender, or the family history, but there are things that we can change that can help decrease our chances of getting hypertension or high blood pressure. And one of the biggest things that we can do is we can decrease the salt in our system. We add so much salt, and guess what most research said? It's not so much that you pick up the salt shaker before you even taste the food. You dump and do. You don't even know what the food tastes like, and you dumping salt on it. A lot of the salt that we get is what we eat, and that's why I cannot stress to you on these shows over and over and over again. You have got to slow down in the grocery store, and you have got to read those labels. It's very important to read the labels. I know years ago there was a soup I used to love to eat in college. Wasn't reading the label because I'm pre-medical school, so I'm just eating this soup all the time. One day, some just said, read the label. I flipped it over. This soup they had 2.5 servings. Now, a little can of soup is about this big, so you know I can eat this whole can of soup by myself. Over 900 milligrams of salt, and I usually recommend to my patients to do at least 2,000 milligrams of salt or less. So that meant if I ate that little one can of soup, I'm done with my salt for the rest of the day. I've used it all up. I have no more salt in the bank to eat. So you've got to read those labels, because the bulk of the salt we get actually come from the foods that we are eating, not so much you picking up the salt shaker. A lot of patients go, oh, I don't salt my food, Dr. Walker. I just eat it just like it is. Well, all that salt is in that food that you have right there. The other thing that you want to do, if you're concerned with high blood pressure and running in the family, you have got to keep an eye on that weight, your ideal body weight, and talk to your doctor about what would be your ideal body weight. Your ideal body weight is calculated every 5 feet you weigh. You can weigh 100 pounds, so nobody can take that away from you. For every inch over 5 feet, we can add 5 more pounds. So say you 5'5". So right now we know you can weigh 125. And then we base it on frames: small frame, medium frame, large frame. I usually cheat with my patients and give them a little bit more. But they be telling me, if I weigh that, Dr. Walker, I'm gonna look so skinny and funny. People gonna think I got the consumption. And what the consumption years ago down south, the old folks, when you got sick, my grandmama and them would always say, that girl got the consumption. So I give them 10 or 15 more for that. So your ideal body weight should not be probably over about 135. So ask your doctor, what is your ideal body weight for you based on your activities and your lifestyle, and try to get to that ideal body weight and try to stay there. So we want to know the family history. We want to stay at our ideal body weight, and we find our weight is one of the biggest deterrents to our health care, is how much we weigh. Other thing you want to start doing is stay physically active. Come off that potato, that couch, you couch potato, you. We are not trying to let you lay up with the remote control every day, all day long, watching television. You cannot do that. All research is showing the benefits of exercise. If you could just do a brief little 30-minute walk at least 4 to 5 times a week, every day if you can, but at least 3 to 4 times a week, that would help your weight immensely. And it also release endorphins, which is those good old feel-good chemicals from the brain that will help you feel a whole lot better. So get up off that couch and do something with your exercise. If you ever heard the old folks, I'm old school, I'm from the country. My grandmama used to always say, if you don't move it, you will lose it. So you've got to move that body around. The other thing you want to do is, if you smoke, you want to quit. Smoking is the #1 cause of preventable death in this country, is cigarettes. So if you want to smoke, I call them killers. You just need to throw them out. A lot of times the best way is cold turkey. We got all kind of ways that you can quit smoking. Talk to your doctor about, tell them you want to quit, you want to set a date, and tell them to give you some ideas of how you can come off those cigarettes. Cigarettes damages, and you'll hear this a little later on our presentation we're going to do on heart disease, damages the blood vessels in the body, and you don't want anything damaging your blood vessels. The other thing that can contribute or put you at risk for high blood pressure is decreased sodium in your diet. And a lot of people don't know. Did you know that if you get real sick and you have a lot of diarrhea, did you know you're losing your sodium and you're losing your potassium? And that's why a lot of times if you've been sick with diarrhea, upset stomach, you feel so weak, you're losing your potassium, and you need your potassium in your body because potassium helps balance the sodium in your body. And the biggest thing again that you want to do is watch that alcohol. Oh, you all out there guzzling alcohol like never before. Alcohol sales are at an all-time high. And let me just bust your bubble right now and make it very plain. Ladies, you can't have but one drink a day. Numero uno. So come out of them happy hours when you in there, when you have your first little drink, and carry yourself on toward the house. And men, I'm finna get you even worse. You can have 2 drinks a day. So just always remember 1 and 2. Ladies, you 1, and gentlemen, you are 2. That's your alcohol for today. And another thing you want to always watch out for is stress. Like my #1 book, I always say in the Dirty Dozen, the worst thing can happen to you is stress. Stress is the #1 killer of everybody. And the reason it is not only do it puts out all these old negative chemicals in the body, the fight or flight and all that. Stress make you overdo things you don't want to do. It makes you overeat. You know, when you stressed out, what's better than a big hunk of chocolate cake with a bunch of fudge and chocolate ice cream piled on the top? You may feel better for a moment, but then after a while you go to feeling really bad. It makes you don't want to exercise. It makes you want to lay around. So stress is really bad for the body and really bad for hypertension, and will keep that blood pressure elevated. Sometimes people come in and have no other risk for their high blood pressure except their stress. There are 2 sources of stress. Either you're going to be stressed from your home, or you're going to be stressed from your job. Or, like they taught us in med school, the worst stress is to be coming from both of them. You got no peace at home, and you got no peace when you get to the house. I had an over-the-road trucker tell me one time, he said, "Dr. Walker, I'm fine until I get about a mile from home." And said, "My wife nagged me so bad, my head started pounding." He says, "A bridge right before I get to the house," he said, "as soon as I hit that bridge, my head started pounding." So, why stop nagging so much and wait for them someday with a little rose in your mouth or something? But don't nag them, especially when they've been on a hard day of work, or even men, if the ladies have been out on a hard day of work. Don't forget to always coach your spouse. Always. So that's another thing. Another thing you need to realize is that when you smoke cigarettes, there are so many chemicals in a cigarette. Do you know there are chemicals in a cigarette that we haven't even identified? We don't even know what it is, but we do know embalming fluid is in there. And like I said, if you wake up feeling a little stiff and a little hard, it could be that embalming fluid. So you want to lay your weapon down. I call cigarettes a weapon. You want to lay them down and put them down. So let's stop smoking. Let's stop drinking so much. Let's get up off that sofa. Stop being a couch potato. Let's stay more positive too. Y'all have gotten so mean. Have you noticed how mean the world has gotten? So let's smile more. Laughter is good for you. Even the Bible said laughter just boosts the whole soul, and it does. So let's try to correct some of these things and start exercising. Now, so you ask me, what are the symptoms of a heart attack? Well, guess what? With most things you're going to hear on this program, a lot of times none. Sometimes people don't have any symptoms until they have a heart attack. But if you do have symptoms, one of the main ones is chest pain. Now, the chest pain can feel like a crushing sensation. I had patients tell me it feels like a big elephant sat on top of their chest and all. You can have that. You can have squeezing pain. You could have indigestion. A lot of patients go to the emergency room thinking they got indigestion and it's heart disease, and vice versa. They go to the emergency room and think they got heart disease and it's indigestion. So any of those types of pains you want to get checked out. You could be cold, you can be clammy, you could be weak, you could get short of breath. If you have any of those risk factors that we've talked about, like with the weight and smoking and drinking and high blood pressure, pressure, you probably want to get that checked out at the emergency room, but for sure call your doctor and tell them the symptoms that you are having, because they can just come from all kind of places. The heart can be racing. Now, a healthy heart, believe it or not, the heart rate is sort of slow. That's why them great athletes like Lance Armstrong and all those guys who do all those cross-country things, guess what? They heart beat every now and then. Boop, boop, boop. It can't be fast, because they would be able to do all those sports that they do. So a slower the heart rate, if you don't have any kind of heart disease and you exercise it, that may not be such a bad thing. So those are some of the symptoms. You can have a nosebleed, like some people, the first time they know their pressure is very high, they have a real severe nosebleed. So again, you're going to want to keep up on your blood pressure at all times. Some of the lifestyle changes we'll talk about, then we'll give you quickly some of the treatments, and then we'll wrap it up. Is 1, you want to lose weight. 2, you want to become more physically active. You want to manage the stress in your life. You want to watch that salt. Put the salt shaker down. In fact, throw the salt shaker out. You don't need it. If you want anything to taste better, throw some herbs on it. Go plant you a garden. What's wrong with a garden? If you don't like to be outside, guess what? You can plant an indoor garden and season more with herbs and things. Because trust me, a lot of foods already got a lot of salt in it, believe it or not. You want to decrease the alcohol. I'll stop. You want to decrease the drugs. You want to stop smoking. Oh, and you want to get a good night's sleep. Studies have shown that people that don't get at least 6 hours of sleep every night, guess what? And you're going to hear this on the heart conversation we do. They're 2 times more likely to have a heart attack. So get a good night's sleep is very good for you. We've already done a show telling you how to get a good night's sleep. So what are some of the treatments that we do? First of all, when we diagnose high blood pressure, we like to see at least 140 over 90 on 2 separate occasions, like a week or so apart. I usually give my patients a diary and tell them, take your blood pressure for me for a week and bring it back to me. Let's look at it and see where your blood pressures are looking, and that's basically the way we diagnose it. The way we treat it is 4 classes of drugs that we use to treat high blood pressure. One of them called ACEs and ARBs, angiotensin converting enzymes or ARBs. These narrow and keep the blood vessels from narrowing as much. You got drugs called beta blockers. They slow the heart rate down so much blood don't get pumped through the arteries. You have diuretics. A lot of people call them water pills, and what that does is remove a lot of water and salt out of the system, because believe it or not, the bulk of your blood is water. So we can pull the water out of the system, we can drop the blood pressure down. And the last one is what we call calcium channel blockers, and these drugs stop calcium from entering the heart muscle cells and a lot of the blood vessel cells, and what that does is cause them to relax. So those are the 4 classes. Sometimes the doctors will use a combination of 1 or 2 just to get your pressure down, but we have ways to treat your pressure. So I think if we can get the pressure down, you can do these lifestyle changes. Medications only if you need it. And do you have to be on medications forever? Not really, if you do a lot of the things we've talked about. I've had patients that I have actually taken off of blood pressure pills because they corrected their lifestyle. Then I think you will live a long, happy life, like my book says, 131 years, free of problems with high blood pressure or hypertension. This has been Dr. Valerie Walker, and this was The Medical Moment.